Hello there! Have you ever looked in the mirror and felt like one side of your face just seems a little off? Or maybe it feels a bit weak? I know that can be a really concerning and honestly, a pretty scary feeling. But don't worry, we're going to figure this out together. What you might be experiencing is a condition called facial palsy. So what is it? Why does it happen? And what can you do about it? Let's break it all down step by step. All right, let's start with the most important part, the symptoms. As I go through these, just take a moment and see if any of them sound familiar to you. The most common sign is a sudden weakness on one side of your face. You might find it hard to close one eye completely, or maybe when you smile, only one side of your mouth seems to move. Sometimes you might notice a bit of drooling, your speech could become a little slurred, or even your sense of taste might change. If you've noticed any of these, it's definitely something you want to pay attention to. So what exactly is this thing called facial palsy? Let's dive into the basics of what's happening. To put it simply, we have a very important nerve, the facial nerve, that controls all the muscles in our face. When that nerve gets damaged or inflamed, the signals from your brain to your facial muscles get blocked. And when the muscles don't get those signals, they become weak. That's facial palsy. And it almost always affects just one side of the face. So how does that happen exactly? Well, think of it like this. Your brain sends out a command, like smile. That command travels down the facial nerve, which is kind of like a wire, to your facial muscles. But what happens if that wire gets pinched or damaged? Exactly. The command can't get through. And as a result, the muscles on that side of your face just can't respond. Okay, so that leads to the next big question. Why would this nerve get damaged in the first place? Well, there can be several different reasons for this, so let's take a look at what they are. Now, the nerve can get damaged for a lot of reasons. Sometimes the culprit is a viral infection, like the one that causes cold sores, but other times it can be a symptom of more serious conditions, like a stroke or a brain tumor. Things like a head injury, diabetes, or even certain autoimmune diseases can also lead to it. And that's exactly why it is so important to see a doctor to find out the specific cause. And now we're getting to the most crucial part of all of this. How do doctors figure it out, and what are the treatments available? The first step is always a clinical exam by a neurologist. They'll likely order an MRI of your brain to rule out anything serious like a stroke or a tumor. They might also do a test called an EMG to check how the nerve and muscles are communicating, and blood tests to look for any infections or signs of diabetes. And here is the most critical point I want you to take away from this. The sooner you start treatment, the better the chances of a good recovery. So please, if you notice any symptoms, do not wait. Go see a doctor right away. The treatment plan has a few parts. First, you'll likely get corticosteroids like prednisolone to reduce the swelling around the nerve. If a virus is the suspected cause, you might get antiviral meds too. Now, a really important part of treatment is protecting your eye. Since you can't close it fully, you'll need to use things like artificial tears and ointments. Facial physiotherapy is also a huge help in getting your muscle strength back. Surgery is really only considered in very rare situations. Okay, so along with the treatment, there are a few extra things you need to be mindful of while you're recovering. Let's go over them. The number one thing to be careful about is your eye. Since you can't close it all the way, it can get very dry and irritated easily. So make sure you use those eye drops exactly as your doctor tells you. Another thing to be aware of is something called synkinesis. It sounds like a big word, but it's simple. It just means that as you heal, some of your facial wires can get a little crossed. For example, you might smile and your eye might close a little bit on its own. It's just good to know that this can happen as part of the healing process. So I really hope you have a much clearer understanding of facial palsy now. Remember, the key thing is that with a quick diagnosis and the right treatment, this is a condition that you can absolutely overcome. Are you ready to take that next step for your health? Don't ignore the symptoms. Please seek help from a medical expert as soon as you can.